Hello, my name is Heaven Garcia. I will be doing the head-to-toe assessment CPE on Mr. Bear, beginning now. So first I'm going to wash my hands. I'm going to provide for patient privacy, and then I'm going to identify myself. Hello, my name is Heaven. I'm going to be your nurse today. I'm doing a head-to-toe assessment on you. Is that okay? Okay, I just need you to identify yourself. What's your name and your date of birth? Then Bear. Okay, your date of birth for me? Yeah, everything matches Clifford's band. Okay, so what year is it? Okay, who is our president? And do you know where you are right now? Okay. All right, the patient seems alert and oriented times 4. Are you having any pain today? On a scale of 0 to 10. 0, okay, that's perfect. All right, so now I'm going to assess the vital signs. Okay, I'm going to just check the heart rate here. Heart rate is normal. While I'm doing this, I'm also going to assess the respiration rate. Okay, that's perfect. Check your blood pressure, and your blood pressure is normal. Okay. All right. I'm going to look at Mr. Bear. I'm going to see that he doesn't have any visible lacerations or masses on his face, and neither on his arms. His respiration seemed to be unlabored, so that's good, and he appears to be calm. Okay, so I'm going to start with your head, okay? All right. I'm just going to feel around, make sure I don't feel any abnormalities, no lumps. Assess the hair for any infestations. I don't see any lice. Everything looks good, no lacerations. Okay, his face is completely symmetrical. There is no drooping. Eyes look symmetrical. Pupils are 4 millimeters, equal. Everything looks good, okay. Alright, so first I'm going to start off on the eyes. I just need you to open and close your eyes for me, please. Okay, that's perfect. And can you please smile? Can you frown? And can you puff up your cheeks? Okay, that's equal. Alright, that's perfect. So now I just need you to look away from this light for me, please. Pupils are constricting. Pupils are constricting. While I'm here, I'm looking at the sclera. The sclera is white. There's no jaundice. I don't see any swelling. And conjunctiva is pink. Okay, perfect. There's also no drainage. Alright, so if you could just please look at this pen for me. Pupils and eyes are accommodating. Okay, so what I'm going to have you do, I'm just going to have you follow this pen with your eyes for me, please. Okay, so that is perfect. Alright, so now I'm just going to assess your ears. And they look absolutely healthy. Tympanic membrane is intact, no drainage, and there's also no mass, no swelling. Do you have any tenderness back here? No tenderness. Okay, it's not swollen, and it's also not red. So that's good. Okay, so now we're going to move down to your nose. Now look at your septum here. It's not deviated. There's no redness. There's no drainage. No polyps either. Okay, nose is symmetrical. Okay, that's wonderful. I'm going to take a look at your mouth. Okay, mouth is pink. Lips are pink. Okay, can you please open your mouth for me? I'm going to check inside the cheeks. Just make sure that the cheeks are intact. Alright, mucosa is pink and moist. Alright, I'm going to have you stick out your tongue and say ah. Okay, back of the throat looks good. Uvula is up. Okay, I'm just going to make sure that you have a gag reflex. I'm going to stick my tongue depressor inside. And he does have a gag reflex. Okay, if you could please lift up your tongue for me. No lesions and no abnormalities. Okay, so now I'm just going to test your reflexes here. Alright, can you please clench your jaw for me? I'm going to feel this masseter here. Temporal here, clench it again. Okay, and then can you open and close your mouth? Now when we do this, we're just checking for clicks and grading, and there isn't any, which is perfect. Okay, now we're just going to feel the maxillary sinus and frontal sinus. Does this hurt when I press? No? Okay. We're going to feel for the temporal artery. Pulse is bounding. 2 plus. Perfect. Okay. So now we're just going to turn Mr. Bear's head to 30 degrees, and we're just going to check for jugular vein distension, or JVD. And I don't see any distension here on his neck, so we're just going to palpate the carotid here, one at a time, and lightly. Bounding 2 plus. Okay, so other side. Bounding 2 plus. Okay, that's perfect. We're going to check the neck now for symmetry. And I see that the neck here is symmetrical. Okay, perfect. We're just going to now palpate lightly. Make sure there's no masses, abnormal lumps, and I don't feel any or see any. So now we're going to start checking for lymph nodes, and we're going to start here in the front of the ear. I'm going to go to the back of the ear, occipital, carotid, jugulodigastric, submandibular, submental, superficial, cervical, deep cervical chain, and supraclavicular. Okay, something else that we need to do is we need to listen to the carotid artery for any abnormal sounds. Make sure that we don't hear any bruit. And I don't. Okay, Mr. Bear, so now I'm just going to move on to the upper extremities portion of this exam. Okay, so we're going to recheck the radial artery, and we're just going to make sure that it is symmetrical and bounding. Yeah, all right, everything appears normal. So now we're going to go to the brachial artery, and we're going to feel for the same thing. Symmetrical, bounding. Okay, so we're going to test the capillary reflex now. Okay. Less than 3 seconds. Skin ticker. Perfect. And now I just need you to grip my fingers as hard as you can. Can you push back while I'm pushing on you? Okay, muscle strength here seems good. And now I just need you to lift your shoulders for me against my hand. Okay, so that is perfect. I'm going to bend your elbow here just to make sure your joints are moving good. Does this hurt? No crepitus? Okay. Can you wiggle your fingers for me? Clench and unclench them for me. Does that hurt? No, and I don't see any abnormalities here in the skin or in the joints. No redness. Everything looks really good. Okay, so now we're going to go and assess the chest. Hard to see here, Mr. Bear. Okay, so we're going to go in and we're going to look at the chest, and we're going to look at the diameter of the chest. And the diameter of the chest is normal. He is not a barrel-chested bear. This is good. So now we're going to go in and auscultate our chest and make sure everything sounds normal. We're going to start at the second intercostal space on the right side of Mr. Bear. So Mr. Bear's right side. And this is going to be your aortic. We're then going to move just over the sternum here, same side, same place, but only the other side, to the pulmonary. Perfect. Okay. We're going to go down to something called Erb's Point, and this is at the third intercostal space on the left-hand side. Perfect. Tricuspid, which is the fourth intercostal space on the left-hand side. Perfect. And then we're going to listen to the mitral, which is also the place where we find the apical pulse. While we're here, we're going to listen for a full minute, just to make sure the pulse here is normal. This can be found mid-clavicular in the fifth intercostal space. Perfect. Okay, so now I'm just going to switch to the bell of my stethoscope, and we're going to do this one more time to make sure we don't have any abnormal noises. So, aortic, pulmonary, Erb's Point, tricuspid, and mitral. I hear nothing abnormal, everything sounds good. So now we're going to start with the lungs. We're going to start at the apex, which is right here. Hard to tell on Mr. Bear, but up here. We're going to start right here. And now we're going to go to the other side in the exact same spot. Go down one. Can you breathe in for me, Mr. Bear? Yeah, breathe out. Other side. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay. So while we have Mr. Bear here sitting up in this position, we're going to also take this chance and do the posterior lung assessment. So we're going to look at Mr. Bear here. And this is a patient, not a bear. We're going to see that his spine is straight and he's sitting up nice and tall. We're going to look at the back, and we're going to look at the skin before we assess these lungs here. We see the skin is intact. There are no pressure points here. And we're going to also look down here. No pressure point. The skin is intact. Everything looks good. This is important because the skin is on the back is where they lay down the most. So we're going to start again from the apex. Listen to the lung sounds. Take a deep breath. And out. Take a deep breath. Out. Take a deep breath. Out. Again. 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 And again. Okay, so when you're doing the lung inspection on the back, you just want to make sure that you are not listening over the scapula here, because you won't be able to hear the lung sound. So you want to make sure you're going between the spine and the scapula, and you're kind of going through there. Okay, so next we're going to check the abdomen. All right, so we're going to have Mr. Bear here lay down for us. Okay, so I'm just going to check your abdomen. You want to make sure you get the patient's consent. It's kind of a sensitive area. Okay. Have you had any tummy troubles lately? When was your last bowel movement? This morning? Okay. Have you had any urinary problems? You've been able to empty your bladder regularly? Frequently? No? Everything seems normal, okay? Have you been dribbling at all? No? Okay. Okay. So now, before we palpate, before we touch, we're going to inspect. Do you see any distension of the abdomen? No, everything looks round and soft and good. Okay, you see anything that normally would not be sticking out? Nope, everything looks good. So now, before we palpate, we're going to auscultate for vowel sounds, just to make sure that we have 5 to 30 within the minute that we're listening. We're going to listen to each quadrant. So we're going to start in the lower right quadrant. upper. I'm going to go to the left hand side, do the same thing, and go down. Vowel sounds are good. Okay, so now we're also going to listen for vascular sounds of the abdomen. We're going to start with the aorta. Okay, nothing abnormal. The renal. Okay, other side. The iliac, which is down here. Okay, and then the other side. Okay, so now it is time for us to palpate the abdomen. We're going to first palpate very lightly, and we're just going to make sure we go around again, each quadrant of the stomach, and we're going to make sure we don't feel anything abnormal. No rigidity, everything is soft, no masses, nothing that appears to be swollen, out of place. Okay? Does that hurt? Does any of this hurt? No? Okay. So now we're going to go a little bit deeper. We're going to take this, and another technique is to put your hand on top of this hand and make a press. And make sure that we still don't feel anything abnormal. Now, if when you lightly press this, you felt something abnormal, you would not continue to this step, because you could cause something to rupture. Okay, so everything appears to be good there. Now we are going to move on to the lower extremities. Okay, Mr. Bear. So we're just going to ask for permission first. Is it all right if I uncover your legs? I can do an assessment on those. Yes. Okay. We're going to check for hair. Some venous disease, peripheral diseases. If you don't have hair, it's a big sign. So we're going to check for that. Mr. Bear is very hairy, as you can see, and his legs are warm, very warm. We're also going to check the skin color, make sure it's not brown. Okay. Or abnormally brown, I should say. Everything looks good. Yes. All right. We're going to look at the bottom of his feet. There are no lesions. There are no sores. Toes look good. There are no lesions or sores on the toes. Okay. And we also don't see any of that anywhere. Do we see any edema before we even start touching? I don't see any edema. Okay. So we're just going to go in and we're just going to check for edema. Just in case. We're going to put our finger on the tibia. We're going to leave it there for just a moment, just to see if we can see some edema. And I do not see any edema on him. Okay, we're going to check the other side. You always want to check the other side. Perfect. Okay, so now we're just going to check the pulse. So we're going to go to behind the knees, the cocktail. Bounding 2+. Okay, we're going to check the Dorsalis pedis. Okay. Tibia. Tibial pulse. Here. Posterior tibial. We're also going to check the capillary reflux on the toes. Okay, so we're going to do the same test that we performed here. I just need you to push against my hand with your feet. Mr. Bear can. He has very good reflexes here. Okay, and if you could please lift your leg. Well, we could do one at a time because it's hard for people sometimes. So we're going to have you lift your leg to meet mine. Make sure that we can do that. Okay. The same thing on this side. Okay. And then we're just going to check for the Babinski reflex. I have my thing here. Feel that? Yep. Toes curl. Feel that? Okay. Yep. Toes curl. Perfect. Okay. So now we're just going to have Mr. Bear here dangle off the side of his little bed. and we're going to check his reflux. Your hip, the knee, moves up. Okay, other side, moves up. Okay. Everything on his leg seems symmetrical. Everything appears normal. Once again, no lacerations. Okay, and we could just check back one more time. The real bottom part here. I can turn over. We just want to make sure that there are no sores on the bottom of his heels and no sores on the bottom of his hips and sacrum area. Those are places where you can have some skin breakdown from laying too long. Okay. All right. I am finished with your head to toe assessment, Mr. Bear. So I'm just going to lower my bed back down. Okay. And we'll make sure the call light is in reach. I'm going to perform hand hygiene. And that's it for Mr. Bear.